You know, every single time you go to the doctor, a story gets written about you. But it's not in English. It's in this powerful, almost secret code, a universal language that tells this incredibly detailed story about your health. And today, we're going to crack that code together.
So take a look at this, S72.001A. What does that look like to you? Maybe a Wi-Fi password? A license plate? It just looks like a random jumble of letters and numbers, right? But what if I told you that this little code tells a complete and probably pretty painful human story? What could it possibly be?
Get this. It means someone has a fracture of the right femur. And that little A at the end, that tells us this is the very first time the doctor is seeing them for this injury. I mean, think about that. In just 7 characters, we know the injury, the exact bone, which side of the body, and even where they are in their treatment journey. Now that is the power of this code. And that code for a broken leg is just one of, well, tens of thousands. These little codes are tucked away in every single medical chart, and they form this universal language that the entire world of healthcare literally depends on.
This whole system is called ICD-10. It stands for the International Classification of Diseases 10th Revision. The easiest way to think about it is like the ultimate medical dictionary for the entire planet, and it's maintained by the World Health Organization. It's got a unique code for pretty much any health condition you can imagine.
So, why do we even have this? Well, it's pretty much the backbone of modern medicine. It's how we make sure a diagnosis for, say, pneumonia means the exact same thing in New York as it does in Tokyo. It's how insurance companies get billed accurately. And, maybe most importantly, it's how scientists track things like a flu outbreak or monitor the rise of chronic diseases on a massive global scale.
And you know, this wasn't an idea that just popped up overnight. This quest for a universal medical language, it goes back more than 100 years. It actually started way back in 1893, just to classify how people died. But then, after World War II, the World Health Organization took over, and that's when things got serious. They expanded it to include illnesses, not just death. And as medicine got more and more advanced, the code had to keep up, which finally led to the super specific version the US adopted in 2015.
And let me tell you, that upgrade was desperately needed. The old system, ICD-9, was just running out of gas. It only had about 14,000 codes, and it was so basic it couldn't even tell you if an injury was on the left arm or the right arm. I mean, come on, modern medicine just got way too complex for it.
The switch to ICD-10 blew the doors off, expanding the codebook to over 70,000 codes. That massive jump is what allows for that incredible level of detail we saw with the broken femur. It was a true quantum leap in how we describe medicine.
So, a system with over 70,000 codes. How on earth does that even work? It sounds ridiculously complicated, but there's actually a really clear, logical structure to it. So let's crack it open.
Okay, let's go back to our code S72.001A. The first letter, S, that puts us in the big bucket of injuries. The next 2 numbers, 72, they narrow it down to fractures of the femur. Then the characters after the decimal, 001, get super specific, telling us it's the neck of the right femur. And that final letter, well, that's about the visit itself. It's like a funnel, getting more and more precise.
But really, it's that 7th character that's the secret sauce here. This is what turns a diagnosis from a single snapshot into a story that follows you over time. A is for the initial visit. If that patient comes back for a follow-up, the code would end in a D. And if, say, years later they get arthritis from that old break, the code might end in an S for sequela, a late effect. It actually tracks the patient's whole journey.
Okay, so now we understand the language, right? We can read a single code, but what happens when we start listening to millions of these stories all at once? This is where a single code in a chart transforms into these unbelievable population-level insights. It's really all about seeing the big picture. When researchers can analyze millions of these anonymized patient codes at the same time, they can suddenly see the entire landscape of public health unfolding right in front of them.
So for example, public health officials can look at all the codes for anxiety disorders. That whole group of codes starts with an F, and they can see if anxiety is rising faster in one part of the country versus another, or maybe in a specific age group, and that helps them direct resources right where they're needed most.
Researchers can also map out entire patient journeys. They can follow, say, all the patients who were diagnosed with hypertension, that's code I-10, and see which medications they were prescribed, when treatments were switched, and what other health issues came up. This is how we figure out the most effective ways to treat diseases.
And of course, this data drives medical innovation.
A company that's developing a new asthma drug, for instance, can analyze all the J45 codes to see exactly how many people have asthma, how severe it is, and what treatments aren't working for them. This data points research and development right at the biggest needs.
Let's look at a really clear example with diabetes. A company doesn't just see diabetes. They can see the difference between a patient with simple type 2 diabetes versus one who also has kidney disease versus one who's developed cataracts. That level of detail, that granularity, it's an absolute game changer for understanding a disease and creating targeted treatments.
So let's bring this all home. Why does this kind of nerdy, bureaucratic coding system matter so much to every single one of us?
Because it gives us a single source of truth, it's a universal standard that's unbelievably specific, it's clinically accurate because it comes straight from doctors, and it allows us to track health not just for a moment, but across a person's entire life.
At the end of the day, it's about turning data back into human stories. As one expert put it so well, the codes unlock the clinical narrative, transforming these raw, cold numbers into knowledge that can actually save lives and push medicine forward. So the next time you see one of those weird codes on your medical paperwork, you'll know. You'll know it's more than just for billing. It's a single word in a global language that connects your personal health story to this huge, ongoing project of improving human health for everyone.
It really is the silent, powerful language that makes modern medicine work. And as our ability to analyze all this data gets better and better, it just leaves you with this one big question. What incredible stories will our health data tell us next?